This module deals with general precautions for the prevention of work-related injuries in EMS. Once completed with this module, you should be able to identify ways to prevent EMS work-related injuries. While this particular module is relatively short, as some of the topics either have been or will be discussed in other modules, the information is still very important for EMS providers' safety, health, and well-being. If you remember from our introductory module, the CDC reports that more than 22,000 EMS workers visit emergency departments each year for work-related injuries. In looking at EMS holistically, there are several areas in which EMS providers are more at risk for sustaining injuries. The first is ambulance crashes. While a previous module talked about some statistics regarding ambulance crashes, the most pertinent to this discussion is that unrestrained ambulance occupants are at greater risk of sustaining severe or fatal injuries in serious crashes. As reported by NHTSA, EMS providers did not use safety restraints in 80% of the crashes investigated by NIOSH. We know that seatbelts save lives, yet EMS providers, who should know better, are often complacent in wearing safety restraints, especially in the back of the ambulance. Many states have seatbelt laws, and those laws routinely apply to emergency vehicles just as they do to civilian passenger cars, trucks, and other vehicles. Wisconsin law requires the use of safety belts in all emergency vehicles unless such use could endanger the safety of an occupant. Even in the back of the ambulance, there are not many scenarios in which the patient would be endangered by the crew members because they are wearing their seatbelts. Using seatbelts in the ambulance is one quick and easy way to help prevent significant injury to EMS providers. According to the CDC, the workplace injuries that occur with the most prevalence in EMS are sprains and strains to the back and neck. Of the 22,000 EMS workers that seek treatment in the ED each year for work-related injuries, more than a quarter of those ED visits are for body motion injuries that include excessive physical effort, awkward posture, or repetitive motion. Practicing safe lifting techniques is critical to reduce these injuries. As recommended by the CDC, this requires providers to utilize proper body mechanics when lifting patients, using the legs and not the back to do the work. Improving communication is also important as some injuries occur when one provider attempts to lift a patient before the other providers do. If mechanical devices can be utilized to reduce the physical exertion required by EMS providers to lift patients, they should be employed. EMS providers should also call for assistance from additional emergency workers if more lifting power is needed. The more providers you have to assist with lifting a bariatric patient, for example, the less weight each individual provider must bear during the lift. Another emerging issue for EMS is that of sleep deprivation and inadequate sleep. As reported by Industrial Safety and Hygiene News in 2012, the Harvard Medical School performed some research on the link between insomnia and workplace accidents and injuries to find that insomnia is responsible for approximately 274,000 workplace accidents and errors per year, with the financial impact of approximately $31 billion in extra costs. The National Sleep Foundation also reports that highly sleepy workers are 70% more likely to be involved in accidents than non-sleepy workers, and those with sleep problems are nearly twice as likely to die in a work-related accident. Many professions, such as airline pilots and truck drivers, already limit the amount of time a person can work within a certain period, and the trend is filtering over into healthcare as well, where several studies have documented a correlation between healthcare provider fatigue and increased medical errors. Patient care concerns aside, however, fatigue can lead to injuries, and within a profession that already has too many injuries, the prevalence of 24-hour shift work in conjunction with inadequate undisturbed sleep, given calls for service that interrupt that sleep, adds up to EMS provider injuries that could have potentially been avoided if the provider was well rested. Beyond traditional injuries, some studies have shown a link between fatigue, sleep deprivation, and lack of sleep quality to other health problems like obesity, diabetes, hypertension, cardiac disease, stroke, depression, anxiety, and PTSD. Thus, obtaining adequate sleep is of critical importance within EMS for both the safety of the workforce as well as the patients we treat. Beyond the lack of adequate sleep, the prevalence of obesity and a lack of physical fitness is another area in which EMS would benefit from some changes. A widely published 2009 study found that 77% of all new recruits for fire and EMS services in Boston were either overweight or obese, which correlated with other studies that found 3/4 of active emergency responders nationwide were obese or overweight. Simply stated, EMS providers are failing to take care of themselves physically through adequate physical fitness and proper nutrition. Many EMS providers are sedentary, spending a lot of time sitting around the station or in the ambulance while eating fast food, snacking on treats available at the station or in ED report rooms, and drinking lots of soda, coffee, and other sugar-laden or caffeine-charged drinks. From the days of their initial education within the profession, EMS providers must learn about and practice tenets of proper nutrition and exercise for their own benefit, health, and longevity. Being physically fit benefits providers in numerous ways, including a greater resiliency to injury. Another important area of focus for reducing injuries in EMS is for providers to have an awareness of hazards within their environment. This can vary from the obvious, like passing traffic on the scene of a motor vehicle collision and downed electrical wires, to hazards that may be easily overlooked, like a wet and slippery floor at the station. Essentially, the work environment for an EMS provider is ever-changing and hazards abound. Uneven or slippery walking surfaces, hazardous materials responses, violence against EMS providers, motor vehicle accidents, station hazards, bloodborne pathogen exposures, environmental temperature extremes, and other potential hazards are always present. EMS providers must be aware of their surroundings and the environment in which they are functioning while taking reasonable and common sense precautions to minimize exposure to and risk associated with numerous and various hazards. As discussed in a previous module, ensuring adherence to standard or universal precautions for healthcare providers while also following OSHA regulations, even if you are a public employee and not all OSHA regulations apply to you, can go a long way in preventing inadvertent injury. This also recognizes the need to take steps to minimize both communicable and bloodborne disease transmission through appropriate administrative controls, engineering controls, work practice controls, and proper utilization of personal protective equipment. Maintaining a safe and healthy workplace is an ongoing effort that requires the participation of everyone within the organization. EMS providers in particular must be ever vigilant to various hazards within the work environment and take steps to avoid those hazards and risks associated with them. Given your completion of this short module, you should now be able to identify some ways to prevent EMS work-related injuries. If you would like to learn more about general practices to maintain a safe and healthy working environment, you are strongly encouraged to seek additional educational offerings on the topic. This presentation was prepared by Waukesha County Technical College in Pewaukee, Wisconsin, and is distributed with an Attribution, Non-Commercial, Share-alike 4.0 International Creative Commons license. Copyright 2019, Waukesha County Technical College. For information on WCTC's numerous fire and EMS educational offerings, please visit us online at wctc.edu.